Good morning, everyone. I am Dr. Raghav Malik from Center for Sight. I am speaking on Dr. Mahipal Sir's behalf. I am a consultant to JJSV, and also we do receive research grant for clinical trials. So this is a study which is possibly the first in the world to compare the visual outcomes, dry eye, contrast sensitivity, falling, smile, and silk. So we have been VisuMax users for the past decade now, and we also were the first to use the silk platform, that is the Elita. So we do have a more than a decade experience in smile and about half a decade experience in silk. So this is just a comparison of the machines. So if I compare the VisuMax, so these are currently available lenticle platforms. One is of course the VisuMax 500, that is the original KLX platform. Now we have the VisuMax 800, the Zima, that is the Z8, the ATOS by Schwinn, and the Elita by Johnson & Johnson. So if I just compare the VisuMax and the Elita, so what the major difference is, of course, the laser frequency. So we have gone from a 500 kilohertz to a 10 megahertz. So the jump is phenomenal. So of course the laser machine has become very, very fast. Also the energy per pulse has decreased. That is the major factor that is giving the advantage of those very smooth dissections. Then the laser cut time has decreased from 30 seconds to about 16 seconds. And also the patient interface is curved in the VisuMax, vis-a-vis that in the Elita it is flat. So a flat interface actually means your cornea is getting flattened after applanation. So the advantage you get is you can do a post-docking centration. That is, the lenticule can be moved around once you have docked. Number one, and also once you have docked, you can do a cyclotorsion compensation for higher cylindrical powers. The machine does not have an inbuilt automatic centration. We do have manual centration that we can mark the 0, 180 and the center of the visual axis, and after docking the lenticule can be actually just moved around. So the lenticle geometry is also one of the most important factors. The lenticle geometry in a VisuMax is a plano-convex. That means one side of the lenticule is plane and the other side is convex. While the lenticule in the Elita or the silk is a biconvex. That means both the surfaces are convex and both the surfaces are refractive. So this is the advantage that you're getting in the Elita. So on the right side you have something which is the Elita, and on the left side you have something like the VisuMax. You have smaller bursts of energy that are placed close to each other. So this is what happens when you tear something which has a bigger laser spot size that is separated by bigger distances. So once you tear this sheet of paper, you're going to see that the edges are pretty ragged and it is difficult to actually tear apart. But then if you have something that has very small laser spots that are placed very close to each other, you're going to have something very, very small. So the edge is of course very clean and it is very easy to cut. This is something that translates onto the cornea. That is why you have very smooth lenticule dissections. But on the flip side, when there are so many spots placed close to each other, there is more energy. So more energy is being given on the whole to the cornea. So the collateral damage can be higher. As of now, we don't have the option to separate these spots, that is increase the line and spot spacing, but soon we should be. So the study design and objective, it was a prospective comparative interventional study where 100 eyes, 50 eyes undergoing silk and 50 eyes undergoing smile were examined at 6 months. The parameters that were examined were UCVA, BCVA, dry eye and the contrast sensitivity. The energy same in the respective laser machine for all cases, that is for all cases we did not change the energy. The VisuMax has 26 nanojoules with spot separation 4 and line separation of 2 microns, and the Elita was 32 nanojoules with less than 1 micron of spot separation. As of now we can't change spot separation, but soon we will be. Single surgeon, same surgical technique. So these are just the preoperative parameters for both the silk and the smile group. So looking at the visual outcomes, 96% of silk eyes achieved 20/20 or better versus 94%. So I'm talking about 20/20 or better. So when we had started our silk journey, our energies were somewhere around the 70. Now we have come to 30. So that decrease in the energy is what is giving us those clean visual outcomes and the early visual recoveries. So the plus minus 0.5 predictability was 95% in silk and 93% in smile. So that was comparable. There was no statistical difference. So now this is the main slide. So I'm going to flip between two slides fast. So this is the silk and this is smile. So if you see the main difference that you are seeing is in the red columns. So the red column means 20 by 20 on day 1. So if you compare, so this is again silk and smile. So what's happening is that 75% of the eyes actually got 20 by 20 on better day 1 in the silk, and 50% got 20 by 20 or better. So of course they were all better than 6 by 9, of course. That is the least expected. But 20 by 20 or better, we got in 75% eyes of silk vis-a-vis 50. But of course, at 1 month, all patients were 20 by 20 or better. So there is no comparison between silk and smile that way. So there was faster, earlier visual recovery in the silk once we decreased the energy. Refractive stability between 1 and 3 months and 3 and 6 months was same in smile and silk. And the mean change, or the MRSC, in the silk was 0.03 and in the smile was 0.01. So this was comparable. So the change in Snellen lines, that is 45 and 46 eyes had no change, and 45 and 45 eyes gained 1 line at the end of 3 months, and there was a gain of 2 lines or more in the silk group at 3 months and 9 in the smile group. So the surgeon score for dissection, this is where the silk actually scored better because of the small spot sizes. It was easy to remove. So 90% actually said that no, that is grade 0 dissection was required. And now coming on to the difference again, like I said, was in the spot sizes. Now the complications, there were higher complications in silk. Why? Number one, because it's a harder dog. So we had more subconjunctival hemorrhages, that is in the silk group. Now coming on to the incorrect plane entered, so all eyes we entered the correct plane. So the advantage of the biconvex lenticule lies here. So if you see the edge is biconvex, so going into the upper and lower plane is much easier. So there was none of the cases where we actually entered the wrong plane. Dry eye parameters, they were comparable both in the smile and the silk. There was no statistical difference. Then contrast sensitivity, smile actually lagged. Silk was leading. Why? This is one of the earlier cases of the Elita. If you see, just under the microscope, the cornea or the surgical surface of the Elita is much cleaner compared to the smile. This is under just a regular microscope, but again there was no statistical difference in the contrast sensitivity. So to conclude, both smile and silk are adequate for lenticular extraction at 6 months. 95% of the silk and 90% of smile eyes were within plus minus 0.5. Visual recovery was faster with silk. Incidence of non-visual side effects was higher in the silk eyes. Silk felt slightly better in terms of dry eye, but it was statistically insignificant. Limitation was we require a larger study. Surgeons may have a bias and need contralateral study, that is one eye smile and one eye silk, to actually get a better answer. Thank you so much.
So Dr. Raghav, you compared it with Visumax 500.
Yes, sir, with the 500, yes, of course.
But Visumax 800 is, how do you compare with
So we don't have it, so I cannot do a direct head-to-head trial.
I think once you are comparing the advanced machines, you should take both the advanced
Yes,
ones.
of course, that definitely will be a better trial, sir. But
Smile was the first, I think Visumax was the first machine, then the better machines came.
Yes.
Visumax 800 is also good.
Yes.
I think Elita is also good. So
of course,
the comparison can't be done with the older version.
Like I said, so all machines at now are giving you 6 by 6 at 3 months. There is no comparison that way.
Dr. Kankaria, you're comparing Visumax 500 or 800. You can.
Contractual study.
Yes.
Which requires some ethical approval. Also time. Stability. Yes, stability. Silk has gone through some troubleshoots in the beginning. Now it has come to some good stability. So definitely we are in exciting era that a lot of KLX platforms are fighting with it. Yes. Thank you, sir.
So the competition makes the things better, I think.
Thank you, sir.
Thank you, Dr. Raghav.
Thank you.